Before we start the conversation, let me just introduce myself.
Okay.
I'm Arif Nashin and I'm currently doing A-levels in Taylor's College, Subang Jaya,
Okay.
and this is my second semester.
Okay.
So, into the conversation. As we all know, cholera is an infectious disease. The reason I made this video is to know more deeper about this disease. So I hope that you can give a clearer explanation to me and also to everybody.
Okay. Cool. Okay. First of all, thank you for choosing to interview our clinic team on this topic. Again, disclaimer: we're not infectious disease specialists, but we're general doctors. But we do have some knowledge of this disease. Maybe not much experience because it's quite rare in this day and age, like at least in Malaysia, and in other developed countries and all. So I will do my best to share as much as I know about it. Hopefully it will still be of some good value to you, and your team. So basically, cholera is an infectious disease. It's caused by the Vibrio cholera bacteria. So in the microorganism family, you've got different classes or types of microorganisms. So bacteria is one whole, I think, genus, one whole family, and then you've got your viruses, and you've got your parasites, and so on and so forth. So it's caused by the bacteria Vibrio cholera, and there are many strains of cholera, but there are two what we call pathogenic strains. That means they can cause severe illness in humans. And they are normally transmitted. The bacteria itself is normally transmitted from feces of patients who have the disease, and then later on that feces maybe goes into like water sources like rivers, and contaminates water, contaminates food. So that's one of the ways it transmits to other people. So people who drink that contaminated water and eat that contaminated food, without cooking it thoroughly, can get cholera. Or another way of getting it also, it's like maybe there's improper hygiene, where the patient passes out the infected motion of feces, and that motion of feces is not dumped properly, and then so it spreads to other people, or sometimes the patient themselves don't wash hands after going to the toilet, after passing motion, and then they come into close contact with other family members or friends. Then that's how the bacteria can pass as well. Okay, so that's some of the ways, but it mainly spreads from feces of patients that have been infected by the bacteria having the disease, and then how the feces goes into passes to someone else or the environment. Then that's how it affects, and then infects other people. So as long as the other people get in touch with the contaminated contact, or the feces, or the water, the food, or whatever that's in the water, could be like shellfish and all that's not cooked properly, they can get the disease. And if they catch the bacteria, then the bacteria basically will multiply within the body, and then it will basically infect the body and cause the patient to have a potentially serious illness. So some of the symptoms of a patient with cholera would be having watery diarrhea all of a sudden, and then some of the severe symptoms could be, for example, having bad vomiting, to a point where they have bad diarrhea, bad vomiting, they lose a lot of liquids in the body, and they become very dehydrated to a point that is life-threatening. Yeah, so that's briefly about cholera. Yeah, what causes it, how it's transmitted, and what are the symptoms commonly. Yeah. Okay, so it all comes back to understanding how that the bacteria is transmitted. So like I said earlier on, the main thing is someone gets infected and then they pass feces, and then the bacteria is contained in that feces, and then it is passed to water or food sources, or somehow indirect contact with another person. So how we can prevent it is, like, for example, to make sure that we drink water from a clean water source. Now, I mean, where possible, don't just drink from rivers or so on and so forth, lakes and all, the sea directly, but not drink from the tap now that we have processed clean water. But if we really are stuck in the jungle and we only have live water sources to drink from, no tap, then at least boil the water. Yeah, but even if you drink from the tap here in the city, we should boil the water as well. Yeah, so one way is to drink boiled water that is from a clean water source, yeah, as far as possible. The other way is to make sure we cook the foods properly. That means try to avoid eating undercooked foods or half-cooked foods. Yeah, okay, and then the other way would be to make sure there is good sanitation facilities, like to try to make sure that there are proper toilets built, so that the human waste is disposed of properly with proper sewage system and all that. But that one is on the bigger picture, is on the authority level. But as an individual, at least, if let's say you are staying somewhere where there's no toilets, bury your waste. As simple as that. And don't throw your waste into the river. Simple as that. If you go camping, you're stuck in the jungle, these are some of the proper ways to handle your waste. And always wash your hands after going to the toilet. Yeah. And otherwise, sorry, yes? Oh, okay. Yeah, so that's that. Also, try to avoid direct contact with people whom you know are sick with the cholera disease. Yeah, and if you really have to come into contact with them, let's say you're taking care of them because they are your family members, then make sure you have practice good hygiene, wash your hands, take a bath, change your clothes, don't come into too close contact with them. Yeah, so these are some of the practical ways to control the spread of the infection. Yeah. Okay. I think right now in this modern day and age, it's mainly still prevalent in Africa, but not all parts of Africa. I can't fully comment like which specific parts. Maybe some parts of Asia as well, yeah. But otherwise, in most developed or developing countries, cholera is not found or hardly found. Like in Malaysia, it's really quite rare. At least previously when I was working in the government hospital in the general wards, personally I have not come across a cholera case in the years that I was there. So it's quite rare this day and age. Okay, as mentioned earlier on, the common symptom would be to have a frequent watery diarrhea, loose stools, and they may also have vomiting. They may have stomach pain, fever, yeah, and then they may have symptoms of dehydration if they lose too much liquid from their bodies, either ways, from diarrhea or vomiting. Shower regularly, change your clothes regularly, clean the room regularly or the environment regularly. Don't share the same utensils as them for personal belongings like towels and all that. Some very practical things. Yeah. Normally they would appear quite fast. Yeah, within a couple of days it should appear already. Yeah, they normally appear quite fast.
Okay, thank you, doctor, for the great detailed explanation. Before I end this video, do you have like any friendly reminder you want to share?
I guess in this urban setting, just remember to wash your hands, frequently, especially after going to the toilet, before you eat and all that, and also drink water from clean, trusted sources. Try to avoid eating too much undercooked foods. Yeah, and if someone is sick, just keep a safe distance from them. And if you're sick yourself, also just keep a safe distance from people. Just stay at home and rest where possible.